Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Liver cancer. Introduction. Liver cancer is cancer that begins in the liver. It is one of the most common types of cancer in the world. Liver cancer can be a life-threatening condition, but it may be cured if found early. This program helps you understand what liver cancer is and what its treatment options are. This program does not discuss cancer that has come to the liver from another organ, also known as metastatic cancer to the liver. Anatomy of the liver. The liver is the largest organ in your abdomen. It is found right behind your ribs on the right side of your body. It sits below your diaphragm and above your stomach. There are two sections of the liver, called the right and left lobes. Under the liver is the gallbladder. Parts of the pancreas and intestines are also under the liver. The liver keeps you healthy by removing harmful substances like toxins from the blood, making enzymes and bile that help digest food, converting food into substances needed for life and growth. The liver has two blood vessels that supply it with blood, the hepatic portal vein and the hepatic artery. Most of its blood comes from the hepatic portal vein. The rest comes from the hepatic artery. The hepatic portal vein carries blood to the liver from the stomach, small and large intestines, spleen, pancreas, and gallbladder. Liver cancer. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way. Other times the old or damaged cells don't die as they should. These extra cells build up over time and cause an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are almost never life-threatening. They can usually be removed without growing back. If a tumor does invade and destroy nearby cells, it is called a malignant tumor. A malignant tumor may grow back if it is removed. Malignant tumors are also called cancerous tumors. Cancer can be life-threatening. Cancerous cells may spread to different parts of the body. They mainly spread through blood vessels, but may also go through lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and structures called lymph nodes. The objectives of cancer treatments are to kill or control abnormally growing cancerous cells. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the liver will always be called liver cancer, even if it spreads to other places.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes and risk factors. It is usually impossible to specify the cause of cancer in an individual patient, but we do know what causes cancer in general. Healthcare providers also know factors that can increase the chances of getting cancer. These are known as risk factors. The more risk factors a person has, the more likely liver cancer will develop. But many people with known risk factors for liver cancer don't develop the disease. Certain hepatitis viruses over time can cause liver cancer. Long-term infection with hepatitis B virus or hepatitis C virus is the main cause of liver cancer. Hepatitis B and C are spread through blood or sexual contact. There is a vaccine available to prevent hepatitis B. Researchers are still trying to develop a vaccine for hepatitis C virus. The risk of liver cancer increases with the amount of alcohol that a person drinks. Having more than 1 or 2 alcoholic drinks each day for many years increases the risk of liver cancer. Aflatoxin can also cause liver cancer. Aflatoxin is a harmful substance made by certain types of mold. It can form on peanuts, corn, and other nuts and grains. Aflatoxin levels are high in parts of Asia and Africa. Liver cancer may develop in people whose bodies store too much iron in the liver and other organs. Hemochromatosis is the name for having too much iron in the body, including the liver. Most cases of liver cancer happen in people who first had cirrhosis. Cirrhosis is a serious disease that develops when liver cells are damaged and replaced with scar tissue. Hepatitis B and C, heavy alcohol use, too much iron stored in the liver, certain drugs, and certain parasites can all cause cirrhosis.
Obesity and diabetes also have been shown to raise a person's risk for liver cancer.
Symptoms. Early liver cancer often doesn't cause symptoms. Once the cancer grows larger or spreads, people may notice signs. Common symptoms of liver cancer are pain in the upper abdomen on the right side, a lump or feeling of heaviness in the upper abdomen, swollen abdomen like bloating, loss of appetite and feelings of fullness, weight loss. Other signs include weakness or feeling very tired, nausea or vomiting, yellow skin and eyes, pale stools, and dark urine from jaundice, fever. If you have any of these symptoms, you should see a healthcare provider as soon as possible, but in most cases, these symptoms are due to a medical condition other than cancer. Diagnosis. If you have the symptoms of liver cancer, your healthcare provider will perform some tests to find out what is causing your symptoms. The symptoms of liver cancer may be caused by other health problems. Your healthcare provider will perform a physical exam and check the liver, spleen, and other organs for any lumps or changes in size or shape. Your healthcare provider will also check for an abnormal buildup of fluid in the abdomen. Your skin and eyes may be examined for signs of jaundice. Blood tests can be used to check for liver problems. One test detects alpha-fetoprotein, or AFP. High levels of AFP could be a sign of liver cancer. Other tests show how well the liver is working.
A CT scan may be done to take a series of detailed pictures of your liver, other organs, and the blood vessels in your abdomen. Sometimes an injection of contrast material is given so the liver is clearer in the pictures.
An MRI is also used to make detailed pictures of areas inside your body. Contrast material may also be given for this test. An ultrasound of the abdomen may also be done. Sound waves are used for this test. The echoes of these waves create a picture of the organs in your abdomen, including your liver. Usually a biopsy is not needed to diagnose liver cancer, but the healthcare provider may remove a sample of tissue. A pathologist will examine the tissue under a microscope to look for cancer cells. There are 3 ways in which a biopsy can be performed: a needle through the skin, laparoscopic surgery, open surgery. A needle through the skin removes a small amount of tissue from the liver. A CT scan or ultrasound may be used to guide the needle. Laparoscopic surgery is when the surgeon makes a few small incisions in your abdomen. A thin, lighted tube is inserted through the incision. Tissue is taken from the liver with this tube. Open surgery is when the surgeon removes tissue from the liver through a large incision in your abdomen. Staging. Liver cancer can spread to the lungs, bones, and lymph nodes near the liver.
If you have liver cancer, staging is an attempt to find out if the cancer has spread, and if so, to which parts of the body. Stages may be described using the numbers 1 through 4 or the letters A through D. A lower number or letter indicates an earlier stage. Staging is helpful in deciding the best course of treatment.
If liver cancer has spread, then the abnormal cells in another part of the body are the same as the original. For example, if liver cancer has spread to the bones, then the cancer cells in the bones are actually liver cancer cells. Your healthcare provider may order some tests to find out if the liver cancer has spread. A CT scan of the chest may be ordered. This can show if the liver cancer has spread to the lungs. A bone scan can show if the liver cancer has spread to the bones. For this test, you are injected with a small amount of a radioactive substance. It travels through the bloodstream and collects in the bones. A machine scans and makes pictures of the bones. A PET scan can show if the liver cancer has spread elsewhere in the body. For this test, you are injected with a small amount of radioactive sugar. The PET scanner makes pictures of the places in your body where the sugar is being taken up. Cancer cells show up because they use sugar faster than normal cells. From these tests, your healthcare provider will be able to tell if your liver cancer is spread. Your treatment plan depends on what stage of liver cancer you are diagnosed with. Treatment options. Staging is only one factor in determining which treatment is right for you. How well your liver is working and whether you have cirrhosis is also important to consider. Other factors are your age, general health, and any concerns you may have about certain treatments or their side effects.
Treatments for liver cancer may include one or more of the following: surgery, including a liver transplant, ablation, embolization, alcohol injection. Treatments also include targeted therapy, radiation therapy, chemotherapy, immunotherapy.
Surgery to remove part or all of your liver may be done if the cancer has not spread. If part of the liver is removed, your liver may regrow the missing part. If the whole liver is removed, you will need a liver transplant.
Ablation uses heat, extreme cold, or chemicals to destroy cancer in the liver. It may be used for people waiting for a liver transplant or for people who are not healthy enough for surgery. Ablation is used to extend life and is not a cure.
Embolization is a procedure that causes a blockage. For this procedure, tiny sponges or other particles are injected into the hepatic artery by a catheter to block blood flow through the artery and kill the tumor. This may be temporary or permanent.
Sometimes healthcare providers will choose to inject absolute alcohol into the liver tumor to destroy it. This could be done with a needle or a surgical incision.
Targeted therapy uses oral medications to slow the growth of liver tumors for people who cannot have surgery or a liver transplant. It also reduces the blood supply to liver tumors. Radiation therapy uses high-energy rays to kill cancer cells and stop them from growing and spreading. The radiation that treats the cells comes from a machine that aims the rays at a specific area of the body. Radiation therapy may also be delivered internally with radioactive materials that are placed near the cancer inside the body.
Chemotherapy is the use of drugs to kill cancer cells. Chemotherapy may be given in the bloodstream through an IV, or it may be injected directly into the liver. Immunotherapy, or biological therapy, fights cancer by boosting your body's immune system. It may help your body kill cancer cells, slow down their growth, or prevent them from spreading. Immunotherapy may be used to treat advanced liver cancer.
Patients with liver cancer have the best chance of surviving if the cancer is found very early and treated surgically. There are also clinical trials available for people with liver cancer. Clinical trials test new medical approaches and treatments.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Liver cancer is one of the most common types of cancer in the world. Liver cancer can be a life-threatening condition, but if it is found early, it may be cured through surgical removal of the cancerous tumor.
Long-term infection with hepatitis B virus or hepatitis C virus is the main cause of liver cancer, but there are many other causes of liver cancer.
There are many treatments available for liver cancer. These may include surgery, including a liver transplant, ablation, embolization, alcohol injection, Other treatment options include targeted therapy, radiation therapy, chemotherapy, immunotherapy. Some factors in deciding which treatment is right for the patient include if the cancer has spread, how well your liver is working, and your overall health.
Thanks to advances in medical treatment and technology, it is now possible to treat liver cancer if the cancer is found early. The earlier the cancer is found, the better the chance for successful treatment.
Thank you for using Explain.